eu me chamo Ana Júlia.
Eu me chamo Kamylle.
Eu me chamo Bianca.
E nós somos alunas do segundo período de radiologia e vamos falar sobre acidente vascular cerebral, mais conhecido como AVC.
This is the second part discussing stroke. In this video, we will cover symptoms, diagnosis, treatment, complications, and sequelae. The symptoms of a stroke can vary, but recognizing common signs that require urgent medical attention is essential. The main warning signs of any type of stroke include weakness or numbness in the face, arm or leg, especially on one side of the body, mental confusion, changes in speech or comprehension, vision changes in one or both eyes, balance, coordination, dizziness, or walking difficulties, sudden, severe headache without an apparent cause. The symptoms of ischemic stroke often appear abruptly and suddenly, sometimes without prior warning. Common symptoms include difficulty speaking, feeling of a thick tongue, or communication issues, changes in facial expression, such as a drooping mouth or loss of expression on one side of the face, loss of motor coordination, difficulty following simple commands, such as raising one arm or walking in a straight line, vision changes, severe headache, dizziness or vertigo, fainting, vomiting. The symptoms of hemorrhagic stroke include intense headache, loss of strength on one side of the body, sudden visual changes, such as sudden blindness, motor symptoms like numbness in the face, hands, and legs. Identifying the early symptoms of stroke is crucial to ensure rapid and effective medical intervention. Time plays a fundamental role in stroke treatment, as every minute without care increases the risk of irreversible brain damage. The acronym FAST-FACE ARMS speech. Time is often used as a guide to identify stroke signs, assess facial asymmetry, arm weakness, and speech impairment, and act quickly upon noticing these symptoms. The sooner a stroke is identified and treated, the better the chances of minimizing brain damage and its sequelae. Imaging exams are essential for the accurate and rapid diagnosis of stroke, allowing identification of the affected brain area, stroke type ischemic or hemorrhagic, and in some cases, the underlying cause. Key exams include computed tomography. This is the most commonly used initial exam because it is quick and effective in detecting brain hemorrhages. It uses X-rays to produce detailed brain images, identifying bleeding areas, swelling, and brain lesions. Magnetic resonance imaging (MRI) provides more detailed images of the brain, allowing visualization of soft tissues and identification of small lesions that may not be visible on a CT scan. It uses a magnetic field and radio waves to generate brain images, differentiating stroke types, evaluating lesion extent, and identifying other brain changes. Cerebral angiography visualizes the brain's blood vessels, identifying blockages, aneurysms, and other abnormalities that can cause strokes. An iodine contrast is injected into an artery, and X-rays are used to create images of the blood vessels, pinpointing the exact location of a blockage or aneurysm and aiding treatment planning. The primary goal of ischemic stroke treatment is to restore blood flow to the affected brain area. Main treatment options include thrombolysis, administering medication to dissolve the blood clot blocking the artery. It is highly effective when initiated within the first few hours after symptom onset. Mechanical thrombectomy, a minimally invasive procedure to remove the clot using a catheter. It is indicated for patients ineligible for thrombolysis or when thrombolysis is ineffective. In addition to clot-dissolving medications, other drugs may be used to control blood pressure, reduce the risk of new clots, and prevent complications. The treatment of hemorrhagic stroke aims to control bleeding and reduce intracranial pressure. Treatment options include blood pressure control, essential to prevent worsening of bleeding. Medications may be used to control blood pressure, prevent seizures, and reduce brain swelling. In some cases, surgery may be necessary to remove the clotted blood or repair. The ruptured blood vessel. Stroke is a serious medical condition that can cause various complications and sequelae, profoundly impacting a patient's life. Hemiparesis refers to weakness on one side of the body, while hemiplegia is complete paralysis of that side. These conditions result from brain damage caused by interrupted blood flow, affecting motor control areas. This can lead to difficulties in performing daily activities such as walking, dressing, or even holding objects. Speech disorders, such as aphasia, difficulty understanding or producing language, and dysarthria, difficulty articulating words, are common after a stroke. These issues can hinder communication, causing frustration for both patients and their families. Swallowing difficulty. Dysphagia is a significant complication that may occur after a stroke, making swallowing difficult or painful. This increases the risk of aspiration, where food or liquids enter the airways, potentially causing aspiration pneumonia. Depression is one of the most common emotional sequelae after a stroke. Patients may experience profound sadness, hopelessness, and a loss of interest in previously enjoyed activities. This condition may be exacerbated by physical limitations and the need to adapt to a new reality. Patients often experience anxiety related to uncertainty about recovery and fear of recurrent strokes. Additionally, the inability to fully participate in social life can lead to isolation, worsening feelings of loneliness and depression. Memory problems are frequent, affecting both recent and long-term memory. This can hinder daily tasks that require recalling important information or previously acquired skills. Post-stroke patients often face difficulties maintaining attention or concentrating on specific tasks, negatively impacting their ability to work or perform activities requiring prolonged focus. Thank you for watching the video until the end. Don't forget to watch the last part.